Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. The small intestine is over 20 feet long and constantly twisting, making it notoriously difficult to evaluate. How do we see deep inside the bowel loops without radiation or colonoscopies? Today, we are exploring MR enterography. We will explain what Crohn's and IBD patients experience during an MRE while breaking down biphasic oral contrast physics, anti-peristaltic agents, and T2 wall hyperintensity for our technologist community. For patients managing inflammatory bowel disease or Crohn's disease, MR enterography provides a comprehensive look at your entire digestive tract. While a colonoscopy evaluates the inner lining of the large intestine, it cannot reach most of the small bowel. MRE uses magnetic fields instead of radiation, allowing doctors to look through the outer bowel wall and surrounding tissue, making it ideal for young patients who need repeated scans over their lifetime. Preparing for an MRE starts about an hour before you enter the scanner. You will be asked to drink a specialized liquid solution slowly over 45 minutes. This solution isn't absorbed right away. It acts like water balloons inside your abdomen, gently expanding the collapsed small intestine so we can see every loop clearly. Right before scanning, you may also receive a quick injection to temporarily stop intestinal muscle spasms. For our technologist community, achieving adequate luminal distension is crucial for diagnostic accuracy. Biphasic oral contrast agents contain non-absorbable sugar alcohols like sorbitol or mannitol that draw fluid into the lumen via osmosis. This yields a dark, hypointense T1 lumen and a bright, hyperintense T2 lumen on steady-state free precession sequences, creating sharp contrast against the enhancing bowel wall. Intestinal motion artifacts can easily obscure subtle mucosal inflammation. Technologists administer anti-peristaltic agents like glucagon or buscopan immediately prior to acquisition. Timing these injections freezes wave-like muscle contractions during fast T2 single-shot fast-spin echo and 3D T1 gradient echo sequences, ensuring crisp, high-resolution cross-sectional views. MRE protocols excel at highlighting active inflammatory markers. Key diagnostic signs include mural thickening greater than 3 mm, high T2 submucosal signal indicating edema, and prominent hyperenhancement on delayed T1 post-contrast sequences. Engorged mesenteric blood vessels feeding inflamed bowel loops create the classic comb sign, while diffusion-weighted imaging reveals restricted diffusion in actively diseased segments. Integrating dynamic cine-MRI sequences adds functional evaluation to structural imaging. By capturing continuous ultrafast steady-state sequences at 1 to 2 frames per second, technologists can observe live bowel motility. Healthy bowel loops show flexible, peristaltic squeezing, whereas chronic fibrotic strictures appear rigid and immobile, helping clinicians differentiate active inflammation from permanent scarring. Protocol design must balance spatial resolution with fast acquisition speeds to manage physiological motion. At 3 Tesla, technologists must mitigate standing wave dielectric artifacts by utilizing dual-drive RF transmit technology. Applying Dixon fat saturation techniques ensures uniform background fat suppression across large abdominal fields of view, preserving signal contrast in deep pelvic bowel loops. MR enterography fundamentally changes clinical decision-making for gastroenterologists. By distinguishing active inflammation treated with anti-inflammatory medications from fixed fibrotic strictures or fistulas requiring surgery, MRE provides a safe, non-invasive roadmap that guides personalized care for patients with IBD. MR enterography combines biphasic contrast, fast MRI sequences, and motion control to visualize the small bowel safely and comprehensively without radiation. Thanks for watching. If you learned something today, make sure to like, comment, and subscribe, and check out our merch store for more cool medical imaging items.